Happy Friday! WebCME wants you to start your weekend with a win. The Clinical Connection Friday feature is Key Concepts in Pressure Ulcers. A common clinical dilemma is the patient with a calcaneal pressure ulcer. To debride or not to debride? That is often the question. This episode of Clinical Connections will address this issue. It is important to remember several things when managing a patient with a calcaneal pressure ulcer which presents with dry heel eschar. First, we know that a pressure ulcer that is covered with necrotic tissue, whether this is wet or dry gangrenous tissue, cannot be staged until it is debrided so that the depth of the ulcer can be adequately assessed. Until debrided, this wound is appropriately staged as unstageable. Secondly, in this setting, the desire to stage the pressure ulcer and thus debride the eschar is not or should not be the driving clinical force. Dry heel eschars should not be debrided unless clinically indicated. So, what are the clinical findings that would mandate debridement? Erythema or surrounding cellulitis, warmth, pain on palpation, purulent drainage, crepitance or frank fluctuance, or systemic signs of infection, such as fever or sepsis, which may be attributed to the wound. Any of these findings, which is consistent with frank infection or the ulcer compromising the patient systemically due to an underlying osteomyelitis, are all reasons to debride the eschar. If the patient does not show signs of systemic infection or other compromise, the heel eschar should be maintained as dry. Eschars provide a good biological dressing in that they are an external barrier and actually provide protection to the underlying tissues. Thus, leaving the ulcer open to air or betadine painting is appropriate here. Don't forget that despite what would be considered a more conservative approach from a wound care standpoint, aggressive offloading remains critical in the management of this patient. That's this week's win. We hope this clinical correlation will enhance your wound care practice. Be sure to send us your questions and follow us on Facebook, Twitter, or LinkedIn. Enjoy a safe and relaxing weekend.